Can prediabetes lead to a stroke? Imagine a condition where your blood sugar is higher than it should be, but not yet high enough to be called diabetes. That's prediabetes, and it's more common than many realize. While it might seem less serious, research shows that prediabetes can actually increase your risk of having a stroke. Prediabetes affects how your blood vessels work. When blood sugar levels stay elevated over time, they can cause damage to the lining of your arteries. This damage promotes the buildup of fatty deposits, known as atherosclerosis, which narrows and hardens the arteries. When arteries in the brain become narrowed, blood flow can be reduced or blocked, leading to an ischemic stroke, which is the most common type of stroke. Studies have found that people with prediabetes are more likely to experience stroke symptoms and actual stroke events compared to those with normal blood sugar levels. The risk is not as high as in people with full-blown diabetes but is still significant. For example, research involving patients with irregular heart rhythms, which already increases stroke risk, showed that those with prediabetes had about a 19% higher chance of having a stroke than those with normal glucose levels. This suggests that prediabetes independently contributes to stroke risk, regardless of other factors like high blood pressure or obesity. Not only does prediabetes increase the chance of having a stroke, but it also affects recovery. Data indicates that individuals with prediabetes are about 68% more likely to face higher mortality rates after a stroke. This means that having prediabetes can make the aftermath of a stroke more severe and recovery more difficult. Another important point is that prediabetes is linked to a higher chance of having another stroke in the future. Conditions like impaired fasting glucose and impaired glucose tolerance, which are markers of prediabetes, are associated with increased cardiovascular risk. Interestingly, measuring how your body handles glucose after a load of sugar, called the 2-hour post-load glucose test, can be a stronger predictor of stroke risk than fasting blood sugar alone. The good news is that prediabetes is reversible. Making lifestyle changes such as adopting a healthier diet, increasing physical activity, and maintaining a healthy weight can significantly lower your blood sugar levels. Sometimes, healthcare providers may recommend medications to help manage blood sugar and reduce vascular damage. In conclusion, prediabetes is more than just a warning sign for diabetes. It is a real risk factor for stroke and stroke-related death. Recognizing and managing prediabetes early can make a big difference in preventing serious cerebrovascular events. If you have concerns about your blood sugar levels or risk factors, it's always best to talk with a healthcare professional who can provide personalized advice and guidance. Remember, taking steps now can help protect your brain and overall health in the future.